Hi, my name is Amanda Coleman. I am an RN at Samaritan Hospital. I'm currently going to Maria College for my BSN. I chose to do my windshield survey on Grafton, New York. I live in Cropseyville, New York, which is right on the border of Grafton. It is a rural area in Rensselaer County. This is the population profile for Grafton, New York. Grafton's last census was reported as approximately 1,200 residents, and throughout the past decade, the population has remained relatively stable with minor fluctuations in numbers. The population density is low, with roughly 27 people per square mile, which is characteristic of rural communities. A good example of this would be myself. We have 3 acres and 1 neighbor. So this gives you a feel of the space between each resident. So it's more of a country area rather than an urban area. The demographics of this area include an age distribution that is predominantly older adults, age around 45 to 50 years old. The race, ethnicity, it's mostly white, but there is a small percentage of other racial and ethnic groups. The socioeconomic status. The median household income is around $65,000. Most occupations include agriculture, small business, and service industries. The unemployment rates are low, but may be higher among youth and seasonal workers. About 10 to 12% of the residents live below the poverty line. The educational level for most adults have high school diplomas, and some have college degrees. Religion in this area is predominantly Christian. There are many active churches, and then there are faith-based community groups. Pictured below is the Peace Pagoda, which was founded by Buddhists, which is also in this area. Marriage and divorce rates for Grafton are consistent with the regional averages with a stable community fabric. In Grafton, the leading causes of morbidity and mortality include chronic illnesses such as cardiovascular disease, cancer, and respiratory conditions. The infant mortality rate is low, and life expectancy aligns with state averages. Leading causes of death include heart disease and cancer. But here in the woods, we also don't mess with the wildlife, including the Grafton bears. The section summary includes the people of the community. The strengths are a close-knit community, a stable population, active faith and social organizations. The potential needs of the area are increased health education, access to preventative care, mental health resources, and youth engagement programs. Problems: aging population, limited healthcare access, and environmental concerns. Why? The demographic trends and geographic isolation influence health outcomes and service availability. The community as a social system. Resources, accessibility, resource utilization. Within government and leadership, Grafton is governed by a town supervisor and a town board, with local offices in Grafton providing services such as permits, community planning, and public safety. For community safety, there are volunteer fire departments and local EMS, which provide fire and medical response. Pictured below is Grafton EMS, and to the right of that is the Grafton fire truck, which is a newer fire truck. They also have disaster preparedness plans that are in place, and those focus on flood and winter storm responses. Communication resources include local newspapers, radio stations, and the town's website, which serve as key communication channels. You can also take a look at Town of Grafton Facebook page, which has a lot of information on it, more than you probably would need. Community leaders include the town supervisor and faith leaders. Although Grafton is very rural, they do have a lot of community outreach. Some examples of this include the Grafton Youth Summer Camp, that is for ages 5 through 13. They do have a food pantry for Grafton for those who are struggling. They have the Rensselaer County Summer Food Program, where kids eat free. That includes a free healthy breakfast and lunch to children ages 15 and under. They are also participating in Color Our World. This is between Grafton and Petersburg, and they have summer performances. And then to the lower right is our small Grafton library. The library offers different events such as Touch a Truck Day and Magic the Gathering card games for the youth. They also participate in a lot of summer programs, and you can also rent passes to Grafton State Park. They have a wide variety of books there for all ages, and they also have a large library online database where you can have ebooks as well. The community as a social system continued. This is transportation. There is limited public transportation. Residents primarily rely on private vehicles. Roads are generally well maintained, but traffic congestion is minimal unless you get stuck behind a Valenti truck who does not do 55 miles per hour in the 55 mile per hour zone. Transportation options for the vulnerable population are limited, which highlights potential access issues. The community as a social system continued. Economics. Major industries include agriculture, small businesses, and tourism associated with the natural resources. That includes Grafton State Park. Median income aligns with regional averages, but economic opportunities are seasonal and limited. Pictured below is R.J. Valenti, and there are two photos of Grafton State Park, which is a local tourist attraction. They also have hiking trails, swimming, kayaking, picnic areas, and playgrounds. Section Summary: The Community as a Social System, Part 1. Strengths: natural resources, strong community bonds, and low crime. The potential needs for the area is better public transportation, expanded healthcare services, and infrastructure improvements. Problems are limited access to healthcare, environmental concerns, and the aging infrastructure. Why? The rural setting and demographic composition influence these challenges. Pictured below is Grafton's Merrymakers to the left. There's an image of the agriculture in the middle, and to the right is the Grafton elderly community. Education, resources, and services. Educational facilities. There are nearby elementary and high schools. Grafton, from my understanding, used to have an elementary school, and then they switched to Berlin or Tamarack, depending on where you live within the area. There are community and SUNY colleges within a reasonable driving distance. Libraries: there is a small public library offering community programs and access to information. Religious resources: there are multiple churches and faith groups that provide spiritual and community support. Education, resources, and services continued. For recreation, this is a highlight of Grafton. There are parks, hiking trails, and community centers that support outdoor and social activities, especially for the youth and seniors. There will be a bass competition for the youth. There is a senior center that often has activities, and there is a polar plunge during the winter. Grafton State Park often promotes dogs and brews. They do moonlit hiking and many other activities. Stores and shops. There are small local stores which serve daily needs. This includes Grafton Town Store. And then there are larger retail options available in nearby towns. Depicted below, the first photo is Grafton in the fall. The second photo includes Grafton's many trails that you can hike, as well as the area of water where you can swim, kayak, and fish. The next photo is also Grafton in the fall. This photo was taken by me. And the photo next to it is a picture of the sunflowers that grow in Grafton every fall. Section Summary: The Community as a Social System, Part 2. The strengths are rich natural environments, active community organizations, and low crime. Potential needs are improved access to health and social services, transportation, affordable housing. Problems: healthcare access barriers, environmental issues, and infrastructure aging. Health services and community resources. Hospitals. The closest hospital is in Troy, providing emergency and specialty care. That would be Samaritan Hospital. The Berkshire Hospital is also close to this area, which is in Massachusetts. Public health. The Rensselaer County Health Department offers immunizations, health education, and screenings. Social services. Local agencies support families, seniors, and low-income residents, but transportation barriers limit access. Community organizations. This includes support groups, food pantries, and senior services, but they need expansion to meet the demand. You may be wondering, is Grafton different from other rural areas? In the next few slides, there are academic journals that I have found to support local findings. The role of distance and community for families with toddlers in rural areas. This is particularly relevant to me since I have an 11-month-old. The study I found examines how distance impacts access to resources and services for families with toddlers in rural areas, and the findings suggest that geographic isolation can create barriers to early childhood support, healthcare, and educational services. A good example of this would be that I have to drive to Latham for my son's pediatric appointments. Although he doesn't have any specialty service needs, if he did, those would also be not close in driving distance. Strong community networks play a vital role in providing social support and resource sharing for rural families, which includes local libraries and community programs to help mitigate the effects of rural isolation. The Grafton Town Library is such a wonderful resource in this area, and I think that the support that they give to their residents is just phenomenal. And then the authors also highlight the need for tailored services and increased awareness to support rural families effectively. This enhances community connections and resource accessibility, and this can improve the developmental outcomes for children in these rural settings. So within this presentation, it seems as though there have been a lot of issues that have been pointed out. These issues include transportation issues, as well as problems finding healthcare within the area. So I found a journal that supports a solution to these issues for rural areas. The journal that I found is called Community Stakeholders Driven Technology Solutions Towards Rural Health Equity, a concept mapping study in Western Canada. Community stakeholder-driven technology solutions are effective in promoting health equity in rural areas. This includes telehealth, mobile clinics, and transportation coordination apps, which help to overcome geographical barriers to healthcare access. I recently learned of the Go Grannies Go transportation services, which is for seniors only, and it is similar to Uber, but you have to be a certain age. Improved transportation options leads to timely medical care, reducing hospitalizations, and enhancing preventative health efforts. Technology-driven solutions increase community engagement and trust, fostering a more inclusive healthcare environment. And these innovations are vital for achieving better health outcomes for populations with limited access to traditional healthcare services. In conclusion, Grafton's major assets include its natural beauty, strong community bonds, and peaceful rural lifestyle. The challenges involve limited healthcare access, transportation issue, and environmental concerns. The primary health needs are preventative care, mental health services, and infrastructure improvements. Nurses and community leaders can contribute by advocating for accessible health services, promoting health education, and fostering community engagement. Prioritizing healthcare access and environmental health could significantly improve residents' well-being and their quality of life. My references are listed below, including the 2 journal articles that I used to support my rural community project and the Town of Grafton page, as well as State of New York Open Data Health, which was useful in seeing Rensselaer County health trends.